With my practicum of social media, I would speak with my audience and talk to them about the different health issues that's affecting the communities, especially maternal health, being one where there is a high rate of maternal morbidity in the United States. And when it comes to PICA, this is something that a lot of people don't really talk about. PICA is a health disorder where people crave different like substance and replace due to their low iron. And I would also promote prostate cancer health um, risk as far as getting yourself checked out. Other information would be about Alzheimer's disease, and I want to touch back on the prostate health, where I would engage with my audience to ask polling questions. These polling questions, I would then um, speak on what they can ask their doctors, what kind of tests they should run. And the next one is Ozempic. Ozempic is something that is very new. It's a weight loss drug that I would speak to the people in the community just to understand what they know about Ozempic, how well they can get information from their doctors, what the injections looks like. And I would kind of want to go back to the smoking cessation, where currently right now there's a high rate of youth and teens having respiratory issues with in response to smoking, and not just smoking cigarettes, but now this is smoking like tobacco and nicotine products through air, so more like Juul, which is the name of a product. Um, these these were products created to help people stop smoking, but in return became something that became addicted to the youth, became more popular since it's more smoking of air particles, um, and creating, a different feeling. It does have nicotine in it, but it doesn't have the smell of cigarettes that a lot of us are accustomed to. So this practicum have been a very eye opener. I would create polling questions, engage with the people of my posts. I will have captivating captions to have them question what is health? What is questions that they can think of um, when they see themselves in the mirror? What are some things they would like to change about themselves? Is it their weight? Is it how they look like? What did the doctor tell you from your last visit? When did you get your last annual checkup? Are you due for an annual checkup? So these are some questions that I would go ahead and ask my community. I would have pre and post survey questions for them to fill out online through the Google Sheets doc. I would have them communicate with their friends and family just to get conversation going to understand what do they know about these topics and how best can these topics create a better way of engaging with the people, and also can there be a way where of less judgment, where in front of God we can be ourselves and we can be truthful in our health, the way we carry ourselves. How can we receive treatment and seek treatment when we don't have faith and we don't believe the news and or we don't believe in the information the doctor is providing us? How well can we get a second opinion if we don't believe the information the doctor and the provider is providing us? Can we get a second opinion? Do we have the strong faith and willpower to ask God to guide us to get a second opinion for your treatments. And if need be, for the second opinion, can it come from a reputable doctor, a clinic, and or if you have to visit a different treatment center, would that be feasible for you as a person dealing with these health diseases and health issues um, pertaining in our community? So these are just a couple of things that I had shared and I had worked on within my practicum to highlight how impactful social media have become when it comes to our health, how social media is a new outlet to receive information, and how older adults can receive information through social media, through their peers. Patients can now ask their doctor, well, I have a friend who went and got this test done. Can I qualify to also get this test completed for my own benefit and for my own health? And if your insurance covers it, then you can get these examinations completed and you can get a better self understanding of where you are in health. Yes, my physical body is healthy, but what about my internal health? What is my internal health telling me? Am I internally healthy? Can I change my internal health with certain treatments, diet, healthy eating? Should I walk more? Should I drink more liquids to stay hydrated? And am I making a conscious decision daily, um, monthly, and yearly to be a better person, to be a better health conscious individual? And as a public health educator, my goal is to always educate others through social media, in person, and wherever I engage in a conversation with others. So I hope that I am able to continue doing the work that God has placed me to be, and also that I'm thankful to the university that I was able to complete my master's program in a way that I feel seen, heard, and I can guide individuals to healthy eating, healthy decisions, and a healthy future.